All right, let's dive straight into this explainer on what I honestly think is a pretty groundbreaking clinical framework, the Rajiv Gupta Integrated Healthcare Model. We're looking at a system here that safely bridges the gap between conventional modern medicine and evidence-informed complementary therapies. If you've ever felt like standard medical care is absolutely brilliant for emergencies, but maybe struggles a bit to optimize your day-to-day health, well, you're exactly who this was designed for. To get a real grip on this model, we're going to quickly walk through 6 key areas. 1. Bridging the healthcare gap. 2. The integrated medicine solution. 3. Assessment, diagnosis, and risk. 4. Selecting therapies and safety. 5. Monitoring, escalation, and follow-up. And finally, 6. A new era of health.
Okay, Section 1, Bridging the Healthcare Gap.
Look, modern medicine is amazing. We all know that. But you really have to ask yourself, what happens when it's just not quite enough? What happens when patients are left dealing with stubborn, persistent symptoms, totally burnt out from treatment fatigue, or just stuck taking a massive load of daily medications? Considering over half of all adults suffer from at least one chronic disease, it's a gap we desperately need to address, right? We see this all the time with non-communicable diseases and conditions like burnout or long COVID.
If you think about it, conventional medicine is absolutely incredible at reacting to acute emergencies. If you're dealing with severe sepsis or a heart attack, you 100% want modern medicine. But where it tends to struggle is with proactive wellness. It's just not built to prevent that slow, chronic deterioration. We end up treating the isolated symptoms instead of, actually creating health in the whole person.
Moving on to Section 2, the Integrated Medicine Solution. So how do we fix this without ditching all the rigorous, life-saving science of modern medicine? Well, the Rajiv Gupta Integrated Healthcare Model maps out this incredibly comprehensive menu of care. It literally puts multimodal, personalized support right alongside conventional treatments. We're talking about bringing in things like yoga, acupuncture, osteopathy, and Ayurveda, all intentionally surrounding the most important element, the patient. It's collaborative, shared decision-making in action.
Now, I really want to make this clear. We are not talking about alternative medicine here. This is a highly governed clinical framework where modern medical science is always the diagnostic and therapeutic foundation. These complementary practices, they're brought in as supportive, adjunctive strategies. They are never there to replace essential medical care.
And because patient safety is the absolute top priority, this whole model relies on super strict clinical governance. Every single recommendation has to be evidence-informed. It's really about empowering you to make educated choices about your health, which makes total sense when you consider that a massive 92% of patients with chronic diseases actually prefer doctors who actively discuss complementary therapies with them.
Which brings us to Section 3, Assessment, Diagnosis, and Risk. This is where we get into the operational heart of the framework, the 8-stage clinical decision-making process. Think of these first 3 steps as laying the blueprint. Before anyone even breathes a word about holistic therapies, we absolutely must establish a personalized health baseline through a comprehensive assessment, get a highly accurate medical diagnosis using standard labs and imaging, and carefully classify your clinical risk. I really cannot emphasize this point enough. The absolute anchor of this entire system is that accurate biomedical diagnosis has to come first, period. You don't just try to treat severe undiagnosed pain with acupuncture, right? No way. You have to rule out emergencies first, establish standard guideline-directed care, and only then do you look at how to support the body holistically. So during that crucial first assessment stage, healthcare teams are capturing very specific objective and subjective markers. They're checking things like your HbA1c for blood sugar, testing your pulmonary function, maybe doing a 6-minute walk test, alongside anxiety scales like the GAD-7. Why go through all this trouble? Because having this comprehensive baseline is literally the only way we can accurately track exactly how your body responds to these integrated treatments over time. All right, Section 4. Selecting therapies and safety.
Okay, so we've got our diagnostic foundation set and our clinical risks classified. Now we move into stages 4 and 5, which is kind of like the interior design of our health house. Clinicians systematically select evidence-informed therapies that fit your exact needs, while aggressively screening for potential harm. A huge part of this is identifying contraindications and utilizing integrated pharmacists to check for herb-drug interactions. You have to be incredibly careful that, say, a botanical remedy doesn't clash negatively with your prescribed pharmaceuticals.
The way they select these therapies is actually a really tangible, tiered approach. It's completely methodical, not just random guessing. Low risk, high benefit things like yoga and mindfulness are deployed first as tier 1 adjuncts. Then, if symptoms persist, they step it up and escalate to tier 2 options, which might be specific Ayurvedic protocols or acupuncture. For instance, when integrating something like Ayurvedic medicine for chronic conditions, maybe it's curcumin for ulcerative colitis or ashwagandha for stress, it is done with a laser focus to target underlying chronic inflammation. But again, it's always acting as a carefully monitored adjunct to standard care. It gets evaluated with the exact same scrutiny as any conventional medical intervention. And that leads us to a completely non-negotiable part of this framework, the strict application of stop rules. If a patient's symptoms start to worsen, or if red flags pop up, like GI bleeding or sudden severe weight loss, the complementary practices are hit with an immediate pause. The system is hardwired to trigger urgent biomedical reviews, so patient safety is never, ever compromised. Next up is Section 5, monitoring, escalation, and follow-up. These final 3 stages of the clinical decision-making framework, stages 6 through 8, are all about making sure your health plan adapts to your body as it changes over time. We're continuously monitoring your progress against those initial baseline metrics from stage 1. If an acute emergency happens, there are clear, hard-coded escalation pathways to get you straight into conventional specialist or hospital care. But if things are tracking well, the focus shifts to continuous follow-up and long-term optimization. And this is where anticipatory AI steps in, and it's a total game changer. Instead of just waiting around for random episodic hospital visits, AI actually links up with everyday wearables to track your physiological data in real time. It can spot tiny, subtle deviations, like emerging sleep disturbances, a slight heart arrhythmia, or early metabolic changes, literally years before they blow up into severe clinical disease. And because we're monitoring these outcomes around the clock, we can actually measure the specific biological effectiveness of our complementary choices. We can literally watch how a practice like yoga drives down inflammatory markers like C-reactive protein and cortisol while simultaneously boosting cellular protection. It completely takes the guesswork out of holistic health. Finally, Section 6, a new era of health. When you rigorously integrate all 8 stages of this framework, it completely shifts the paradigm. We aren't just reacting to disease after the fact anymore, we are actively and predictably creating health. Because while our genomics and our DNA definitely show us our baseline risks, they aren't a definitive life sentence. Modern epigenetics shows us that how our daily lifestyle, our nutrition, our stress, our sleep, our movement, how all of that interacts with those genes gives us unprecedented power to correct imbalances before an illness fully takes hold. So with a safe, governed, and highly integrated blueprint like the Rajiv Gupta model guiding you, you genuinely have the power to change your long-term health trajectory. You don't have to choose between rigorous science and holistic wellness anymore. You really can have the best of both worlds. So think about your own health baseline right now. What step will you take today to optimize it? Thanks so much for joining me on this explainer, and I'll see you next time.